Someone in the United States has a stroke every 40 seconds. It's so common you likely know someone personally who suffered from a stroke. And May is Stroke Awareness Month, and while we may know what strokes are, we may not be doing all that we can to avoid them. So to find out more about that, we've asked Dr. Frei to join us. He's a neurologist at Swedish Medical Center, and let's start with the basics. What exactly is a stroke and what are the different types?
So a stroke is damage to the brain. Most people think of a stroke as lack of blood flow to the brain, and that's the most common stroke by far. It's called an ischemic stroke. And that's where an artery is blocked usually from a blood clot, and that part of the brain that's affected has no blood flow. It's a major medical emergency. You lose about 1.9 million neurons per minute if that part of the brain is lacking blood flow, and that's certainly a major medical emergency. Depending on what part of the brain is affected, your symptoms will vary. So I think the important thing to realize is it's an emergency. Call 911. Get to a hospital that can treat that stroke as fast as possible, because every second counts. There's a term we use, it's called time is brain, and it really is. So if certain things you have to be aware of is that there's a sudden onset, and it may affect one side of the body. So left brain controls the right body. So if you have unilateral weakness or numbness in one side of the body, including the face, arm, or leg, if your speech is affected, if you have vision problems, I think one of the challenges with a stroke is it does not hurt. And your awareness may be altered, so you may not realize you're having a stroke. So it's really important that everyone knows about the signs and symptoms, because it may be a coworker, it may be a teacher, it may be a family or friend that has these symptoms and they're not aware. So you have to be aware so you can call the paramedics and get that person to the hospital as fast as possible.
Absolutely. And how do strokes differ in men versus women? Is there anything that defines the two?
No, it can affect men and women equally. So I think it's not gender specific at all.
Great. And you went through some of the symptoms and signs. What can we all do to prevent our chance of stroke?
Well, that's the most important thing. The best way to treat a stroke is not to have one. So there are certain risk factors that we can avoid. So smoking is very bad. Uncontrolled high blood pressure, uncontrolled diabetes, uncontrolled high cholesterol and lipids, obesity, these are all the things that we can affect. So a healthier lifestyle and avoiding smoking, these are all things that can prevent you from ever needing to call 911.
Wonderful. Good thing for people to know. And tell us, too, what kind of treatments are out there for strokes?
So there's a couple major treatments for ischemic stroke, and that's kind of what I'm focusing on here. There's intravenous alteplase or TPA. So it's an IV clot-busting medication that can be delivered within 3 hours of the onset of symptoms, FDA approved. You can go up to 4.5 hours in selected people, but you have to know the time of last known normal. So when they were without symptoms, and that's when that IV medicine can be delivered. The other type of treatment, which is something I do as a neurointerventional surgeon, is called thrombectomy. So we go inside the artery, steering a catheter from either the wrist or hip artery up to that brain artery, and we actually remove the clot. So that's called thrombectomy, and that's very effective in treating large strokes where a major artery is blocked.
Wow, it's fascinating. Thank you so much, Dr. Frei, for all this important information. I'm sure a lot of people will find it very useful to know. We appreciate it.
Well, thank you for including me.
Of course, and we'll put much more information on strokes on cbsdenver.com. We'll be right back.